Hi, everyone. Thank you, Megan. My name's Nancy Sloat, and I'm the Older Adults Program Manager at the Seattle Public Library. And I work to create programs and services of interest to older adults, things that concern us, information that we need. Um, and also to create opportunities to have fun and to connect with other people with kind of social programs. And I work with many groups and organizations who have lots of expertise and also know lots about and work with older adults and know about the needs in the community. So I'm very happy to be able to partner with the Washington Poison Center. So this is the second of 3 programs that we've offered, and we're going to be offering in July and August. And our 3rd program coming up, and I know Alex and Megan will talk a little bit more about it, is a program on August 13th. And it's called Cannabis 101, and it's going to be talking about things that we should consider, especially for older adults. So today's program is medication management, and it's such an important topic both for ourselves and for anybody who's a caregiver. And I know that, you know, from my own personal experience as a caregiver, I wish I had known some of the tips that you're going to be hearing about today. Just one more piece of information before we start. You can find all of the library's programs for older adults in the library's calendar. And then we even have a special calendar just for programs for older adults. And it's a very easy URL to get to. I'll say it to you, and then I'm going to type it in the chat box. So please check back there often to see what programs might be of interest to you. So thank you very much. And now on to Megan and Alex.
All right, thank you, Nancy. And thank you to everyone who has joined us today. I apologize if you hear any background noise on my end. I'm currently sitting in my bathroom because they're doing construction outside. So hopefully it will be quiet. COVID times are always fun. So Alex and I are really excited to present to you all today. This is personally one of my favorite presentations because I feel like it offers a lot of very actionable strategies that folks can implement right away. So we're going to be talking about medication management, and we'll be sharing what some of the common medication errors and accidents that we see at the Poison Center, and then we will share some easy strategies that you can use at home to prevent those from happening. So I'll have Alex move on to the next slide. He's going to drive for me today. A little bit of housekeeping before we get started. So we're going to have you all stay muted today. But if you have any questions, please don't hesitate to just pop them into the chat box. So that chat box is located in your control panel, which is where you'll see a bunch of other things listed probably. So just type your questions into there. You can send it to just the organizers, so Alex and I, if you don't want anyone else to see, or you can send it to everyone. You'll also see in your control panel there is a bucket or a little thing you can click on that says materials. So I've uploaded a PDF of the slides from today to that materials section, as well as some of the resources that we will cover throughout the presentation. This webinar is being recorded today, and we will post it on our YouTube page. So you are welcome to search for that probably later today or tomorrow. We'll have it up. I'll also be sure that Nancy receives that recording, and potentially the library will share it or post it somewhere. So let's go ahead and get started. Alex, you can move to the next slide. Our agenda today, we are going to start by giving you just a brief overview of the Washington Poison Center, who we are and why we are here talking to you about medication. And then we will dive into those management topics. So medication errors, adverse reactions with medications, accidents, and then we're going to round everything out with a quick little bit on what to expect when you call the Poison Center. Because as much as we would love for all medication errors to be prevented, they're going to happen sometimes, so we want to be sure that you're comfortable. All right, so let's dive into the Washington Poison Center. Go ahead and go to the next slide. So we have existed in some form or capacity for over 60 years in Washington. And the whole point of the Poison Center is to prevent and reduce harm from poisons. So what is a poison? We take a very, very broad definition. To us, anything could be a poison if it's used the wrong way, in the wrong amount, or by the wrong person. So that applies to what you would traditionally think of as a poison, like bleach and household chemicals and stuff like that. But it also applies to a lot of other different substances, like flowers, plants, and berries, medications, drugs, alcohol, fumes, vapors, snake bites and insect bites and stings, craft supplies, glue, household products like that. So a very, very broad definition. So with all of these poisons, we provide a few different services to prevent and reduce harm from them. So first, I have clinical and public health education listed on that slide. So we help educate medical students, public health students, pharmacy students, and we also provide a lot of education to the public, such as what Alex and I are doing here today. And then we have our primary service, which is the Poison Center Telephone Helpline. So that is this number. It is a national toll-free telephone number. So you can call this number anywhere in the United States, and you are going to be routed to your local poison center based on your area code. This phone number is completely free. We're never going to ask you about insurance or charge you for anything. It is available 24/7 every day of the year. So you can call us at 2 a.m. or 2 p.m. and someone will be there ready to help you. We are 100% confidential. HIPAA laws, like they have at doctors' offices and hospitals, those apply to the Poison Center as well. And if English is not your preferred language, we have interpretation services available in over 260 languages. So I'm going to have Alex launch a quick poll just to see if any of you have ever contacted a poison center before. Give folks another few seconds to do that. All right, Alex, you can go ahead and close that poll and share the results. So it's a 50-50 split. Some of you have and some of you have not. All righty, we'll move on now to, so when you call the Poison Center, who are you going to talk to? You will speak with one of our expert staff members. They are called SPIEs, or Specialists in Poison Information. So our SPIEs are a group of nurses, pharmacists, and poison information providers who have gone through a ridiculous amount of training in poisons and toxicology. They have so much experience. A lot of them have been in our call center for a long time. We average about 13 years of experience in our call center. So our SPIEs are very qualified. They may not have heard it all, but they have heard pretty darn close to all. So you can call them about literally anything and they will be able to help you. If they ever are in need of any additional assistance, we also have some on-call board-certified medical toxicologists. So these are MDs who have specialized in toxicology, and they are available around the clock for our staff. There are only 7 in the state of Washington, and all of them work in some capacity for the Washington Poison Center. All right, next slide. So this slide has some of our data from 2019 just to show you the volume of calls that we received. So last year, our SPIEs handled over 125,000 calls regarding more than 66,000 cases. So there's that difference in number because cases a lot of times will involve multiple calls. That could be the Poison Center just calling to check in to make sure you're doing all right, or if it's a more complex case, it might be there are multiple calls required to help treat that individual. Next slide. So where are these calls coming from? The majority of calls are coming from homes or workplaces, schools, but we also receive a lot of calls from medics and EMTs who are either on the scene of a potential poison situation or are en route to a healthcare facility. And then we receive about a quarter of our calls from healthcare providers themselves who are in different facilities or emergency departments, and they are just calling for some consultation on how to treat their patients. So unsurprisingly, for who we are getting calls about half of our calls are about kids younger than 6 years old. If you have ever been around a child, you know they stick everything in their mouths, so it is really unsurprising that they're getting into things that they shouldn't be, and we're receiving calls about those potential exposures. But we are definitely not just for kids. We receive a lot of calls about teens, adults, and older adults, and these calls tend to be more serious than those pediatric exposures because these ones are going to be potentially greater amounts of exposure or medication-related errors, so they do tend to be more serious. Alrighty, so obviously, since we have such a huge definition of what a poison is, there needs to be some way to categorize what in the world we're hearing about. So our spies bucket calls that they receive into these different categories. So there are unintentional exposures, so those accidental exposures, and that's where we have medication errors, accidents with non-pharmaceutical substances, environmental exposures, snake bites, stuff like that. There are adverse reactions, and then there are intentional exposures. So suspected suicide, misuse, which is just inappropriate use of a product, and abuse. But we are here today to talk about medication management. So on this next slide, you'll see the 3 call categories that we are going to focus on throughout the presentation today. So let's dive right into our first category, which is medication errors. I'll lay eyes on the chat box really quick to make sure we don't have any questions. Please feel free to ask questions at any time. Okay, looks like we are good. So first, we'll go to the next slide, which is just what is a medication error? Medication error is basically any of these 5 wrongs. There is the wrong dose, so that could be taking your medication twice or taking 3 pills when you were only supposed to take 2. The wrong medicine means you accidentally took an old prescription or you mixed up which meds you were supposed to take. You took NyQuil when you meant to take Pepto-Bismol, something like that. The wrong person means you took someone else's medication or even a pet's medication. The wrong time, you took your medications too close together, or the wrong way. You swallowed a medication that was supposed to be put on your skin. So regardless of age, medication errors are highly prevalent and they are definitely an issue that a lot of us face at some point. So that 13%, this is actually 2018 data. We almost have the rest of our 2019 data done. So hopefully I can update this soon. So in 2018, 13% of all of our cases were related to medication errors. But even though all ages experience these, older adults are one of the main groups within this medication error category. So I have some more statistics on there. So of all of those medication error cases, about a quarter of them were in adults that were older than 60. So why is that? Lots of different reasons. Older adults, well, first of all, I'm sure all of you have seen in the news that there's been a huge population boom as the baby boomers are aging. So there are more older adults now. A alongside that population growth, there is a lot of increased use of medications, both as medications are becoming more effective and as they're just being prescribed more, and also there's been a rise in conditions that, like chronic conditions that require the use of medications. There are also a lot of age-related challenges that are just naturally a part of the aging process that older adults experience, like worsening vision, grip strength might decline a little bit, cognitive decline, some memory issues, lots of challenges that could put them at greater risk of making a medication error. And we at the Poison Center like to focus our education on older adults specifically because all of these reasons, that it's more prevalent or they're more at risk for it, but also because older adults can be more susceptible to consequences from medication errors. They might not experience any effects at all, but they're also more likely than younger age groups to have some adverse effects from a medication error. All right, so I want you to type in the chat box for me. What do you think are the most common medication errors for older adults? Give me your top 2. What do you think are the most common medication errors? Go ahead and type that in the chat box. Okay, yep. Wrong dose. Anyone else have an idea on that? All right, well, our response was definitely correct on that. So Alex, you can hit there we go. So those highlighted boxes are our most common medication errors. So it's by far and above the wrong dose is very common, specifically double dosing, followed by wrong medicine and then wrong person. So to show you just how easy it can be to make these errors, we're going to go through a series of scenarios today with you. And these scenarios will show you different examples of how errors can happen. And I mean, I know I personally have had some of these scenarios in my own life, so hopefully you'll be able to relate to them a little bit just to see how common this can be. So our first scenario is with Charles. Charles keeps his pills in pill bottles and the packages he receives from the pharmacy, and he always takes his pills after he eats breakfast. So he's had his breakfast, he gets out his medications for his morning dose, but then the phone rings and he gets up to answer it. He talks to his daughter for 15 minutes or so and then returns to take his medications. But he can't remember if he had taken them all, or maybe he just took some of them, so he takes them again to make sure. Unfortunately, this means that he has accidentally taken a double dose of his medication. So, what do you all think is the first thing Charles should do? We'll have you pop that in the chat box again. What is the first thing Charles should do? Call the Poison Center. Yes. Winner on that one. Yep. So if you ever end up in a situation like we just went over with Charles, the Poison Center is here to help. So call us right away if you have accidentally double dosed or you think you might have double dosed, but preferably call us before you do anything. If you're not sure if you've already taken your meds, call us before you take your medications again so we can let you know if it's safe to skip them or if it's all right for you to potentially double dose on them. To prevent an error like this, there are a lot of really easy things you can do. So first, a great way to prevent medication errors is by having some sort of physical organizational system. So a physical way of keeping track of your medications. So some examples are medication checklists, and I uploaded into the materials this medication checklist thing that you see on the left-hand side of the slide. So you're welcome to use that if you would like. We have it posted on our website as well if you need more copies or you don't access the materials on this presentation. So essentially you would just write down the medication's name and then check it off after you've taken it. If that is not a good method for you, you can always use a paper calendar of sorts, just like a wall calendar where you mark things off. You can use a calendar on your phone. There are also a lot of apps that you can download that help you remember to take your medications. The app I have on this slide is called MediSafe. It's free. I actually use it myself, and I find that it's really helpful in remembering to take my medications on time and just to know that I have taken them. Next slide. So, there we go. Pill organizers are another great organizational system. So there are lots of different forms that pill organizers can take. So you can request bubble packaging from the pharmacy, which is what is shown on the left-hand image on the slide. So some pharmacies will offer to bubble or blister package your medications together by dose and time. So like they would put all of your Monday morning medications together in one little package for you. You can also do it yourself with pill organizers. There's lots of different types of pill boxes and more supportive pill organizers that you can use. I have two of the like higher level supportive pill organizers on this slide. So these ones, they offer a lot more features than just a simple pill box where they'll stay locked until it is the time for you to take your medications. Or they'll have lights that flash or audio cues. Some of them will even call you, or they will text or call a caregiver if you haven't taken your medication. Next slide. So it's really important to read medication labels closely, because a wrong dose can be more than just accidentally taking your pills twice. It is also really easy to accidentally double up on medications with the same active ingredients. So that would also be a double dose. This is especially a risk with over-the-counter medications. So I have an example here on this slide of Dayquil. So the primary active ingredient in Dayquil is acetaminophen, which is Tylenol. So Tylenol or acetaminophen is in a lot of other over-the-counter medications. So it's pretty easy to double dose on acetaminophen if you don't realize that it's in all of these different things. Someone might have a cold, so they take some Dayquil, but they also have a pretty bad headache, so they take some Tylenol as well, and that inadvertently means that they have taken a double dose of acetaminophen. So to make sure that you avoid this type of wrong dose, you should follow the instructions closely on those medication labels and packages. Only take the recommended dose at the recommended time increments. Really check the ingredients listed on over-the-counter medications to make sure you don't double dose. So our next scenario is all about wrong medicine. And it's about Cynthia. So a few months ago, Cynthia's doctor decided to change a couple of her medications. Cynthia immediately switched to the new meds, but she never got rid of the old prescriptions in her medicine cabinet. So now it's time for Cynthia to take her evening dose. She's talking to her partner as she grabs her medication bottles, and she accidentally grabs one of her old prescriptions out of habit. I mean, she was on that medication for years after all. She keeps chatting and takes her pills, not realizing she made a mistake. It's only when she's putting the pills away that she notices it was the wrong prescription. All right, one more time. We're going to have you pop in the chat box. What is the first thing Cynthia should do? Anyone? What is the first thing Cynthia should do? No. All right, go ahead, Alex, and move to the next slide. I'm hoping that this response will become really obvious to you all by the end of this presentation. Cynthia should call the Poison Center immediately and tell them what happened. So taking an old prescription or taking the wrong medication is definitely concerning for a few different reasons. So that medication could interact with some of the other medications that you're taking, or it could produce effects that are different or stronger from what you need. So like a good example is blood pressure medication. Maybe you were taking a medication to lower your blood pressure, but now you don't need that same dose anymore. You just need a lower dose of it. Well, if you accidentally take that higher dose or the wrong medication to lower your blood pressure, it might lower too much, which puts you at risk of, passing out, falling. Alrighty, next slide. So I want to focus a little bit on what Cynthia did of keeping an old prescription, because that's very common. People frequently keep leftover or expired meds because they don't really know what to do with it. Like, they don't know how to get rid of it. But it's really important to dispose of unneeded medications because that can prevent accidentally taking it yourself, and it also prevents that medication from accidentally or intentionally getting into the wrong hands. So you might have heard of a few different ways to get rid of medications: flushing them down the toilet, mixing them with coffee grounds or kitty litter, crushing them up, throwing them in the trash. There are lots of different ideas floating around out there. But all of these methods can actually be pretty dangerous for yourself, for other people, your pets, as well as the environment. So the best and safest way to get rid of unneeded medications is to take them to a medication drop box. So we're really fortunate here in Washington because we have a very established medication take-back program. So if you go to this website, takebackyourmeds.org, we actually run it at the Poison Center, and it lists and shows on a map all of the different secure medicine return locations in the state. So you can find whatever is closest to you. You can see what they accept, what they don't accept, where they're located. It's always free, so it's a great tool to have on hand. Most of these take-back locations will accept most of your prescription and over-the-counter medications, but they will say if they don't accept certain things. So COVID definitely presents some challenges with medication take-back because we don't want people to make unnecessary trips to these medicine return locations. So our advice during this time is, if you are already going to be at a pharmacy or wherever the take-back location is, go ahead and take back your meds. Otherwise, please don't make an unnecessary trip. Just safely store those meds at home. So that would be up and away, and if possible, locking them up. And I saw there was a question here. So what do the take-back locations do with the meds? So the take-back locations, the medications are all picked up. They're never opened. So whatever you put into the disposal box, it's never opened. It's taken away and it's incinerated. So no one will have access to your medications at all. Next slide, Alex. So there are some options here in a few counties. King County is one of them that does provide this. So there is disposal by mail that's available for folks who may not be able to get out of their homes. So it's available on request. You can go to that website in red at the bottom, medproject.org. One thing to note about disposal by mail is that not all substances are accepted. So they won't accept vitamins or supplements, illicit drugs, There's a few others that are listed on there that they won't take. There are also separate mail-back envelopes if you have a medicine that you inject or if you have an inhaler. So it's just important to read through what envelope or mail-back method you need for your specific medications. Alrighty, another way to make sure you don't have a wrong medicine error is to use a medication list. So at a minimum, a medication list needs to include all of your prescription meds, any over-the-counter medications you regularly take, vitamins or supplements, and any other substances too. So I don't think we actually, Alex will talk about this a little bit later on actually. So for example, if you take CBD for something, you need to be sure that that is in your medication list. So for each medication or substance, at a minimum, include the name, dose, time, and special instructions for it. And you're going to want to take that with you to every healthcare provider appointment, just so that they can double check it to make sure everything is accurate, as well as to make sure that there aren't any potential concerns or interactions with all of those different substances. So at the Poison Center, we provide a list. Oops, Alex, can you go back a slide? Sorry. So we provide a guide if you don't have a medication list. So it will walk you through everything you need to put in there. So that's available in the materials for you to download today. There's also these worksheets. We use one worksheet per medication for our medication list format. That way, if your medication changes, you can just toss the sheet that is no longer relevant instead of having to create a whole new medication list. Now you can go to the next slide. One last thing on preventing a wrong medication error is to just better understand your medications. Know why you're taking them, how to take them, any important information you need for those meds. So we have another resource, 10 medication questions. So you can take this worksheet with you to provider appointments, pharmacies, wherever, and you can ask them, and it just helps facilitate discussion to make sure that you really understand everything about that medication. All right, so our last scenario in the medication errors section is with Jackie, and it is all about wrong person. So Jackie and her husband share a bathroom and keep their medications in the same cabinet. Jackie's getting ready for bed, and it's time to take her evening medications. She reaches into the cabinet and grabs a bottle, but after she has taken a couple pills, she realizes that she took her husband's medication. Okay, last chat box. I know you guys can do this. What do you think the first thing Jackie should do? What is the first thing she should do? Hint, it's the same as the other one. Poison Center! Yes, call the Poison Center! Yay! Yes, call the Poison Center immediately. So taking the wrong person's medication obviously is very concerning. It can have a lot of risks along with it because that medication could interact with other medications you're taking or with a health condition that you have. So we'll use blood pressure again. If someone already has low blood pressure and accidentally take a medication that lowers blood pressure, that could have some pretty bad effects on a person. So call us immediately. Ways to avoid scenarios like this. First is to always keep your medications in containers. Some people might take out their dose for a day and put them in a bowl on the kitchen counter. If you leave loose medication out, it can be really difficult to tell whose is whose if there are multiple people in the household, or even if you have visitors, they might not realize that it is a medication. My grandma would keep her medication in a bowl next to the candy bowl on the kitchen counter, so it was very confusing. Store your medications separate from those of other household members and pets. So this can be in completely separate locations or just in separate pill organizers. You can use colored bands, like rubber bands, to differentiate between people, or different colored pill organizers. There are lots of different ways you can visually differentiate between people. Wrong person can apply to more than just you. So when you take medications, other people can accidentally or intentionally get into them. So we have some extra safety tips to keep your meds out of the hands of others. And so first and foremost, just keep your medications out of sight and out of reach, especially of any children that might have access to your home. And then lock up medications if possible. This is especially important with any high alert medications. So we define these as opioids, cannabis, sedatives, antidepressants, because these can have very serious effects on someone who inadvertently or intentionally takes them. So we'll go to the next slide, which is specifically references opioids. I'm sure all of you have heard about the opioid crisis that's going on nationwide, and we are very much experiencing it here in Washington too. It connects back to medication safety because 3 out of 4 people who misuse opioids start by using a medication that wasn't prescribed to them. So usually medications taken from a friend or a family member. So if you're taking any of these high alert meds, it's really important to keep them out of reach, out of sight, and locked up. Lockboxes, there are so many different forms of them. You can buy them on Amazon, you can buy them at drugstores. Really whatever shape or form fits your lifestyle. There are so many different ways. Okay, for any of you who are grandparents or ever have any kids visit your home, we have some special tips for you all. So first, never take your medication in front of children. So kids, they love to mimic the adults in their lives. So when they see you taking your medication, they might decide that they want to pretend to take medication too, or they might actually take medication too. Also, keep medications out of sight and out of reach. We've said this a few times already. Keep them in child-resistant containers. Note that child-resistant containers are not child-proof, but they at least would afford a caregiver enough time to hopefully be able to catch the child before they take any medication. Check your carpet and floors periodically for dropped medication. We'll go to the next slide. Pills can look a lot like candy, so it's really important to check to make sure that there's nothing on the ground, because a kiddo likely would have no idea that that is a pill and not a piece of candy. Okay, so we're going to move on to adverse reactions. I think there's one comment here. Is there a good place to buy lockboxes? There are lots of different places to buy lockboxes. Amazon has a ton. You can go into a Walgreens or a Rite Aid or a Bartell's, and they're all going to have different forms of lockboxes as well. I would probably recommend just starting with Amazon and taking a look, because there are so many different forms that you can get. So just seeing what you think would work best for your household. Okay, so we're going to shift over to Alex presenting now.
All right, hello everyone, this is Alex. Let's see, so we're on to adverse reactions now. Adverse reactions from drugs can be unintended side effects from medications. They can also be side effects of drug interactions, so we're going to explore that. And we've got another scenario. So, adverse reactions are super concerning with prescriptions, but we also want to highlight that alternative or complementary medications as well as supplements here as well, because there are so many different types that can cause interactions that could potentially be harmful. So looking at this example, we have Rose. Rose has diabetes, and she hears from somewhere that ginseng can help lower her blood sugar level. So she starts taking it. She starts taking this ginseng supplement, which starts to, over time, interact with her insulin. This makes it harder for her to regulate her insulin, which makes it harder for her to monitor her, regulate her blood levels. And her doctor starts to become concerned that her insulin dose is wrong. So not knowing that she's taking the ginseng, her doctor adjusts the dose. So this is why it's so important to communicate with your doctor, to talk to them, as well as your pharmacist, before taking a supplement. So you can call the Poison Center as well to ask for information about possible adverse reactions to drug interactions. So ginseng is one of many, many, many supplements that can result in an adverse reaction. This is a list containing other supplements. It's not comprehensive. There are so many out there. But it just shows that there are many, many out there that can cause those potential interactions and side effects. So as Megan was saying earlier, using a medication list can be so helpful, but not just for medications, but also vitamins, supplements, and other over-the-counter meds, as well as other substances and drugs. Once again, these resources are on the website. You should be able to see some in the materials as well. So again, just want to emphasize, communicate and talk to with every provider appointment and pharmacy visit. All right, so a little bit on self-medicating during COVID-19. So I'm sure everyone is aware there is so much being said about COVID right now. A lot of claims that are very untrue about potential treatments or prevention measures. And so just to kind of clear the air a bit, there are currently no approved medications, vaccines, supplements, vitamins, or any other substance that can prevent or treat COVID-19. So be very cautious about anything you hear claiming this is a cure. Some of these products that are being touted from a variety of sources could possibly be harmful and even life-threatening at times, and they can also, as we've been talking about with other medications and substances, they can interact with medications. So once again, talk to your doctor or your pharmacist, or give the Poison Center a call before trying anything new, whether it's a medication, a vitamin, or a supplement. Never, under any circumstances, ingest disinfectants like bleach or non-pharmaceutical substances that claim to prevent or treat COVID-19. And as always, give us a call. Call the Poison Center if you're uncertain if something is safe or not. Doesn't have to be an emergency to call us. All right, a little bit on substance use. So this is a little tricky. It's not, substance use doesn't quite fit into the adverse reaction category, as there can be a couple different ways that substance use can cause issues with medications. The first is interactions, which is very much an adverse reaction. Some substances can interact with other medications a person is taking, kind of alter how your body's processing or absorbing those other medications. Intoxication itself isn't really an adverse reaction, but intoxication symptoms can actually make it difficult for someone to manage taking medications successfully. And we're going to go through a few specific examples over these slides. And I will emphasize there are so many substances out there. We only have the time today to talk about these three: alcohol, opioids, and cannabis or marijuana. So starting with alcohol, one concern and consideration is that older adult bodies can take longer to process and break down alcohol. This means that effects can last longer, and having that larger period of opportunity means that there's a greater chance for possible interactions. Alcohol by itself, without interacting with anything, can cause problems with concentration and memory. It can lead to drowsiness. And it can interact with medications, again, with drowsiness, dizziness, concentration, and memory issues. And there's also this side risk of double dosing with alcohol, because a lot of other medications already contain some alcohol. So you may be getting much more alcohol intake than you bargained for. And this can actually make some medications less effective, or it can take that medication and make it actively harmful to the body. A little bit on opiates and opioids. I'm sure you've heard these terms plenty, and they actually do refer to something slightly different. One thing I will say, both opiates and opioids, even though they have some distinctions, they operate off of the same parts of the brain. They attach to the same receptors and can cause very similar reactions. So, having said that, an opiate is any drug or substance that's derived from opium or from the poppy plant, so from a more natural source. This includes morphine, codeine, heroin. Now, when we look at opioids, these are at least some level of synthetic, so they're at least in part derived in from more artificial sources. So you have semi-synthetic and synthetic. Again, they attach to those same receptors as opiates, so they can cause similar effects, but they are stronger. They're longer lasting. And the more synthetic something is, the longer lasting and stronger the effects will be. So some of the semi-synthetics include oxycodone, hydrocodone, hydromorphone, and then the synthetics can include methadone, fentanyl, tramadol, and naloxone. Now, one thing with naloxone, for those who don't know, sometimes also called Narcan, this is actually meant to reverse an opiate or opioid overdose, and it's very successful for opiates. It is sometimes successful for opioids because they're synthetic. And they last longer. Sometimes folks have to administer multiple doses of naloxone or Narcan for it to reverse that overdose. All right, so a little bit on adverse reactions. So one concern with older adults, opioids and medication management, is these adverse reactions. Opioids have a stronger impact on older adults because the body metabolizes drugs more slowly as someone ages. So similar issue we saw with alcohol. Because older adults typically take many other medications, there's an even greater likelihood for potential drug interactions. So symptoms of opioid use or effects from interactions can include confusion, sedation, impaired vision, problems with attention and memory, and all causes of mismanagement, which we've covered already. Some people have to be on opioids, though. Their doctor recommends it, and we can't forget that. And so we're not saying go against your doctor's wishes or anything, but it is important to be aware of these possible risks and side effects. All right, switching gears to cannabis and marijuana. So first off, both of these terms, cannabis and marijuana, they do refer to the same plant, the same substance. Now, we want to make something clear that there are components within cannabis we call cannabinoids. And they all act on the same part of, they all act on what we call the endocannabinoid system. Without going into the neurological side of it too much, essentially THC, this is the main intoxicating cannabinoid within cannabis. CBD is another cannabinoid. So there are over 100 known cannabinoids, and they all do different things. We're all still learning about what they do. Now, some products will have just one cannabinoid, like just CBD. Some will have just THC. Some will have a combination of both. Some will have plenty of others as well. So keep in mind that not all cannabis products are equal in that sense. They have very different components within them. And they can take a few different forms. We have dried flower or bud. This is what people will smoke or vaporize. We have concentrates. These are also typically vaporized. Well, aerosolized would be a more proper term there because it's not water vapor being released. And then we have these other, this big other section of tinctures, topicals, edibles, and other medications. And as the industry grows, we're starting to see more and more and more types of these products. So risks for cannabis interactions. So THC and CBD are metabolized in the liver. This is where your body breaks down a ton of other medications and substances. So one problem with or one potential interaction is that having THC, CBD, or other cannabinoids present can alter how your body breaks down other medications. So it can build them up in the body, it can make them stronger, it can make them last longer than intended. There are also these interactions that can lead to drowsiness. They can increase your risk of bleeding. And they can actually have effects on blood sugar and blood pressure. Now, the field of science around cannabinoid effects is still relatively new, so there's not nearly as much info as we would like to be able to make these predictions. So because of this, it is very difficult to predict these potential interactions. So we, as always, encourage you, talk to a doctor and call the Poison Center before attempting to bring cannabis use in, especially alongside other medications. Now, cannabis intoxication, specifically from THC, can actually impair cognition, attention, and short-term memory, so not too dissimilar from alcohol and opioids in that sense. And this can make it difficult to remember if you've even taken a medication. So another kind of tricky thing with THC is for short-term intoxication, a lot of folks experience this altered ability to gauge time. So when in reality, a half an hour has passed, someone who's intoxicated with THC may feel like multiple hours have passed. So they may unintentionally miss a dose or double up on a dose of medication. And also, being intoxicated with anything can make comprehending instructions for medications more difficult. So a bit on substance use safety. So again, talk to your provider, your healthcare provider, talk to a pharmacist, give the Poison Center a call to get an understanding of how of the potential interactions with cannabis and opioids and alcohol and other medications. Using an organizational system such like that Megan has gone through, such as the med calendar, the pill organizers, can really help reduce risk of double dosing or missing a dose, and including substances you use on that medication list in addition to other supplements can really help your providers help you. All right, just making sure I didn't miss any questions. Doesn't look like it. So we're going to now morph to shift gears and talk about accidents. So we hear a lot about accidents in adults over the age of 60. A lot of our calls are around that. And a reminder that accidents are with non-pharmaceutical substances, so it's a different category. Now, in 2018, we had a bit over 1,700 cases of accidents in older adults. But one of the trickiest things is lookalikes. And so this is one of the hallmarks of the Poison Center is trying to educate folks around lookalike substances. So we have a few different ones here. You've got 7-Up, which looks a lot like these other cleaners. You've got this furniture polish, Old English, which looks a lot like apple juice. And if you open that up, it can smell fruity. Sometimes it smells citrusy. And then you have, on the bottom here, you have nasal spray, which can look a lot like eye drops, which can look a lot like super glue, as well as e-cig flavoring or vape juice. E-juice is what it's sometimes called. And these are no good to mix up. We don't want anyone accidentally putting something in their eye that should not go in their eye. All right, so we got another scenario today, just like we've done before. So it's late at night and we've got Jordan here. He's in bed. It's allergy season, which I can relate to. I definitely get spring allergies. His eyes are itchy, so he goes to put in eye drops to kind of alleviate that itch. He doesn't turn the lights on, and he goes to the drawer where he keeps his eye drops, and he accidentally grabs this craft glue instead, because they look a lot alike. They feel really similar, and he unintentionally puts this craft glue into his eye. So we've hit you with this a lot, so I'll just go ahead and spoil it for you. The first thing he should do is call the Poison Center. Once again, there is that number there. So how can we prevent this kind of thing? Well, again, safe storage is key, especially medications that look like other products. So keeping them very far away from each other. Turn on the lights, put on your glasses, just to lay eyes on the product before you administer it. You can use markers, stickers, you can use the Mr. Yuck stickers we have there, tape, other labels like Megan had shown earlier to distinguish those lookalikes. All right, so once again, bringing up the layer of COVID right now, don't mix cleaning products. That's just a big rule everyone should follow. These can actually create hazardous gases that folks can breathe in and can cause a lot of toxicity. Don't use cleaning products on food. I know that the impulse to sanitize everything in the world right now is strong, but it can actually be quite dangerous to end up unintentionally ingesting cleaning products that end up on food. So just rinse and wash your hands very thoroughly. Rinse the food products themselves. So store cleaners and household chemicals and other potentially harmful substances in their original containers. So if you, I know some folks might buy in bulk and want to put it into a smaller container. That can be a little iffy, especially like this example here. You've got Lysol looking a lot like Gatorade. And so keeping them in their original containers is a good way to go. And keeping the products up high out of reach of children. Now, masks are a unique concern these days with sanitizing them. We absolutely want folks to wear masks, and we don't want folks to bleach them because folks can unintentionally breathe in those fumes. So just washing your masks with soap and hot water is a good way to go. Alrighty, so we're going to wrap up with some more Poison Center specific info. Thanks for sticking with us today. We're almost done. All right, so again, call us for any error, accident, reaction, anything like that. Again, you can call to get information as well. We're here to help. So some common mistakes during COVID. A lot of risks for poisoning are made worse, so they are riskier because of COVID. And a lot of it has to do with us being at home more. So we're around a lot of these products a lot more than we normally are, especially cleaners and sanitizers right now. Having new routines, a lot of folks are working from home now. I am working from home right now. So having new daily routines can remove those memory cues. So if you're used to taking your medication when you grab your morning coffee on your way out the door, and you're no longer on your way out the door anymore, you might forget to take that medication. There's more stress and anxiety, and that reduces focus for everyone. We have a lot more distractions right now. There's this constant onslaught of news updates and everything happening, and that can also decrease folks' focus. We potentially have a lot less access to our support, social support as well. That can be so key right now. So that can make things a lot more difficult. And like we said earlier, there are so many rumors and sources of misinformation right now, so it can be hard to know what to trust. All right, so for the Poison Center, who can call us? Well, anyone can. You can call us, a caregiver or family member can call us for you. You can call for someone else, so we're not limited in that sense. Once more, here is that number. If this isn't seared into your brain by this point, I don't know what to tell you. All right, and I want to emphasize too that we are still open throughout COVID. We have not closed throughout the whole pandemic. So what happens when you call us? So we're going to ask you a lot of questions. We're going to ask what was taken, about how long ago it happened, how much of it was taken, and how you or the person you're calling for might be feeling. And then we're going to give you advice. We're going to tell you to either stay at home and watch for certain symptoms and monitor. And for folks who called us from home this year so far, we've been able to keep 92% of them at home. And that's really crucial right now because it alleviates some burden on emergency departments and keeps you from being unnecessarily exposed to COVID. But if the situation is dire enough and our call takers think you should, they will advise you to go to the emergency room. And in fact, they can go ahead and call ahead and let that emergency department know that you are coming. All right, so a lot of times our spies will give you a call back just to make sure things are going okay, do some follow-up, and verify how things are going. You can call, you can ask more questions then, and you can also call back on your own. You don't have to wait for us to call you back. You can call back at any time. Now, a lot of folks have this mentality of, I don't want to waste time if nothing's wrong. And you are absolutely not wasting time. You can't possibly know all the things that are potentially harmful. And so if you can always call just to verify, just to check, that is what we're here for. Our spies would much rather take a call and have it prevent a case than have you not call and have something get worse than it needs to be. All right, Megan, correct me if I'm wrong, but we're about to launch another poll, correct?
Correct.
All right, so stay tuned, folks. Let me get that one all pulled up for you. Unintentional pun there. All right, so how confident are you in knowing how to contact the Poison Center? All right, I'll give it just a couple more seconds folks to answer, then I'll move on to another. We love asking questions. All right, I'll go ahead and close that one. And then we've got a couple more. We'd love to know how you heard about this, how you learned about all this. This being this particular webinar. I suppose I should clarify that. I'll give it another few seconds. All right, I'll close that one. And then we've got one more for you. All right, thanks for playing 20 questions with us. Okie dokie. So big thank you everyone for attending today. If you have any questions, you are absolutely welcome to reach out to myself, to Megan. We're happy to answer. But if you have a poison information question or a poison information emergency, please call that main line. Megan and I are not treatment specialists. We can't help you out there. All right, and we've got an upcoming presentation August 13th at 1 p.m. on cannabis and older adult considerations. Now let me check. Karen, I believe you wanted to, or excuse me, Karen, no, Karen, that was the last, the last webinar. Nancy, my apologies. I believe you wanted to wrap things up. So I have unmuted you if you'd like to add anything here.
Thank you, everybody, for attending. I hope you can come to our Cannabis 101 and learn more than what Alex went through, a little bit more detail on what Alex presented today about cannabis. I also, it would be great to know if you could put in the chat box any other programs that you would be interested in for the library to offer. That would be really helpful to us so that we can make sure that we are responding to the things that you're interested in. So just type that into the chat box. That would be great. And I just wanted to thank everybody very much for attending.
Yeah, Alex and I can hang out here for another few minutes if you have any questions. Otherwise, thank you all for joining today, and you're welcome to sign off whenever you want.